means that you have a great risk of fall.
Great risk of falling. Okay. So what would, when you look at the Morse fall scale, what are some things that would put us at high risk of falling?
Age.
Age?
Medications.
Medications.
Comorbidities.
What kind of medications? Hold on.
Metaprolol.
What kind of metaprolol?
Beta blockers.
Beta blockers. What else?
Narcotics.
Narcotics. Very good. All of those medications can cause somebody to get lightheaded, dizzy, lower level of consciousness, causing confusion, all of that. Okay, so on the scale, which is better, a high score or a low score? A low score. No.
Braden is the only.
Yeah, low score. Yeah, it's the opposite of the Braden, so if you remember that,
Is
lower
Braden
score
the
is better.
only one that's?
Okay, so we said medications is a big risk for falls. Level of consciousness, because remember, if they're confused, right? Huh? I don't think weight is on the fall score as much. but
comorbidities.
I think their ability is. IV lines are huge because a lot of times they have more than one. They want to get up and go potty, and they try to take that and they get tangled up, and then they're on the floor. Having, let's see. So here, a history of fall within 3 months. So if they fall frequently or in the past 3 months, then yes, they're going to be at risk to fall again. A secondary diagnosis. So if they come in for a broken leg, well, let's say a broken arm, okay? If they also have diabetes, okay, their primary diagnosis is the broken arm, right? But let's say they have diabetes too. That's a secondary diagnosis. That's another problem that they have before they ever came to the hospital. If they are, their level of activity, do they walk normal? Or do they have to use crutches, canes, walkers, or furniture? If they have an IV, which most everybody in the hospital has an IV, whether they are able to transfer from bed to chair, wheelchair, what is their gait? Are they strong? Are they weak? Or are they impaired? And then their mental status, whether they have the cognitive level to stay in bed or if they're confused for whatever reason. So all of that, each one of those has a score, and you add it up, and the higher the score, the more at risk that they're going to fall. Okay? No, again, we are not going to ask you necessarily on a test, the patient's doing this, and this, what's their score? We're not going to do that. The question is going to be more like the patient has this Braden or this Morse fall score, or maybe a couple of different scores. What intervention does the patient need? So if the patient is at high risk for falling, what are some things we can do for them to help them from not falling?
Put up bed rails.
Okay, making sure that their bed rails are appropriate and being used
The
appropriately.
bed's at the lowest position.
The lights, making sure that the lights are on at night, maybe just a bathroom light so that they can see their path when they're getting up. Making sure they have their call bell. If they don't have their call bell, they're getting out of bed without assistance, and then we're in trouble, right?
Untangled
The
lines.
bed at the lowest position.
Bed at lowest position.
Untangled lines.
Untangled lines. Huh?
Proximity.
Making sure everything is close to their body. See, all this stuff is not new. Okay? What about, what on the floor? No cushions. What about when they get out of bed? What do they need on their feet?
Socks.
Ripper socks. Ripper socks or their shoes, right? Do other people need to know that they're at high risk for falls? Absolutely. So sometimes, like Ochsner's used to put a yellow armband on them that really stuck out so that other people that may not know what's going on with them know they're at risk for a fall. So for instance, this is little old Meemaw who's confused. She's had a stroke. She's disoriented to everything, okay? And she's in bed, and now speech pathology is going to come in. Does speech know this patient? All I know is she's had a stroke, right? We're going to assess some speech on her because I'm a speech pathologist. Well, her armband alerts them to say, oh, she's at high risk. She has something going on. I need to make sure that I keep her safe. All too often we have I would say other healthcare providers coming in and out, respiratory, you'll have speech language pathology, you'll have therapists come in and out for all different kinds of reasons. And they need to know what's going on with the patient as far as falling so they can be safe. Let's see. Even Ochsner's used to, and I don't know now, they even used to have yellow gowns. The normal patient wore blue, and then the patient at risk for falls wore yellow. So it was just like, woo, okay, you knew for sure that they were at risk. Okay, any questions about the Morse fall scale?